and I'm recording
Okay.
to the cloud.
Yes, perfect. Thank you,
All right,
Amanda.
Jeff.
All
Get
right,
us going.
so we're recording now. So Keisha, we'll introduce ourselves and just kind of run through that kind of thing before we get rolling with your presentation. So this is obviously the CPUN Health and Safety Committee. And my name is Jeff Barron. I've been on the board for a number of years. Interested in this topic. Just a community member. I don't work for anything in the criminal justice or the health sector, but I work for something called the Government Accountability Office, and I have an interest in mediation and health and safety issues. And I'll pass it over to you, Amanda. How about let you introduce
Okay.
yourself?
Sure, yeah. I'm a new member of the Health and Safety Committee. This is my first meeting with Jeff and David. But I have been on the CPUN board for also a number of years. And I think it's like 16 maybe. But it's great to be part of this committee now. And I do have like a small amount of overlap with this work, which is why I was getting excited about the statistics we were just talking about a second ago before we started recording. But not on the criminal justice side, but it's on the health side. But okay, and then I'll pass to David. And so our agenda today is just real quick to do introductions, and then we'll just do brief reports, and then we'll get into our conversation, and then we'll talk about anything else. So I'll pass to David.
Thanks, Amanda.
Oh. I'm David Kugler. I am new to CPUN. This is my first year as a board member, and I'm also new on the Health and Safety Committee. I work for myself, doing accounting, and I also have a podcast that actually makes money. So it's like, that's kind of cool. But I'm just really interested in politics and my life. I just try to embed myself into like political areas just because I'm really interested in it. And I think that like strong communities are safe communities, and I like to think beyond just like policing as like attempting to give the idea of safety. So
yeah, and David is also kind of our community outreach person too. He goes to a bunch of different meetings and things like that. And so Keisha, before you introduce yourself, because we will turn the floor completely over to you, but before we do that, maybe we'll just check to see if there's anything that anyone wants to report back. I unfortunately was not able to be at the last CPUN board meeting. David, I don't know if you've been to any meetings. Anything, David, maybe we'll start with you. Is there anything to report back?
Yeah, I was gonna say I've been attending the Good Neighbor Committee agreements with I'm on the Good Neighbor Committee. The Good Neighbor Committee with the Mayor's Office for Housing and Homelessness issues.
For the Quebec corridor?
Yes, for the Quebec corridor. And so we've started receiving some of like the 911 call data weekly from those sites. And so I was like, I don't know if it would be helpful for me to share it with you all. But I'm happy to.
Yeah, no, you want to, I mean, I think we should do this 5 minutes, like no more, because I want to give Keisha as much time as possible to speak. Okay.
Perfect. Okay, cool. Yeah. And then also the task force to reimagine policing and public safety. The work that we did this summer talked about 3 different like community pillars of safety: healing and empowerment, community intervention, and community power building. And the task force is having an event to unveil the Transforming Our Communities Alliance that we've done on Saturday, September 28th at Carla Madison Rec Center from 10:30 in the morning to 1:30 in the afternoon. So those are, it was going to be early. It was actually going to be this weekend, but they rescheduled it for a couple weeks out, and Liz is going to put it in the CPUN newsletter.
So, oh, good. Excellent. Yeah. Okay.
David, do you also attend the commander meetings that are monthly?
I haven't been, but I would like to start going. I attended the last 2 like mayor's meetings in Montbello and in East Colfax around safety. And yeah, and we actually talked a lot more about budget and like the money that was moved from the public safety department to the Office of social equity and innovation, I think is what it's called. And so I'll be really curious to see more of those kind of numbers now that the budget's been released. And I think, yeah, it was either released today or it's getting released tomorrow.
Amanda, anything, I don't know if there's anything to report back from the board meeting. I know that Kevin was there.
He was,
Yeah.
I let's see. Gosh, sorry. It's been a month now. I don't know that
Yeah.
I have anything to summarize that you wouldn't be able to get from rewatching the meeting. I think it's just like any ways that we can get at the ongoing concerns that people are having about what's happening in the community. I don't know, and just have more of a focus. I think it's just kind of feedback that we can keep
So you
sending.
say ongoing concerns about crime?
Yeah.
So I'm looking at
Right.
my notes too from the board meeting.
Oh, anything that
what-
you can say
Yeah,
would be
so that's
helpful. Thank
okay.
you.
So what Lieutenant Hines said was that 90% of the crime in the neighborhood is nonviolent. And he said that 2 retail spaces drive most of the larceny or like theft in the neighborhood. He said 44% of all shoplifting in Central Park is from 4 businesses. I believe, I mean, I hope you can help me remember. I think he said Walmart, Home Depot, maybe JC Penney.
Okay.
And I don't know if Target was the other one, but like he also talked about the Northfield Mall. So
The Quebec Square and the Northfield Mall.
Basically, which makes sense to me.
Yep. Yep.
And he was also saying that there's been a 100% arrest rate at Walmart in the last 28 days.
Okay. Okay. So they're making trying to control crime at the Walmart.
And then he also said that they're doing more what he called custodial arrests, which is booking somebody instead of just issuing a ticket.
Okay. Okay. All right.
Yeah. And then Dr. Calderon also came and spoke too. And then she talked a lot about how like sometimes just crime statistics aren't necessarily what make people feel safer. It's like safety is a feeling. How a lot of crimes go unreported. So
that's good to know.
Yeah.
Okay, well, I mean, that's things we can talk about, in additional meetings. I think there's some themes maybe that are starting to emerge that we can begin to discuss. But with that, Keisha, we'd like to hand it over to you since you're so gracious with your. Oh, Amanda has something to say.
I have an introduction. So Keisha's here because we are very excited to talk with her today. And she is the program manager for the Colorado Domestic Violence Fatality Review Board. And she's also an executive staff member with the Rose Andom Center, a survivor-centered trauma-informed collaborative that cultivates hope for individuals and families impacted by intimate partner abuse. And so after our 4th domestic fatality in 3 years, we connected to say, like, what else can we do at the community? That's also something that we asked Lieutenant Hines about last month. Like, what does the police want us to do in terms of like a community? And he was like, don't hesitate to call if you hear a disturbance nearby and you think that you might have an impact. And that in the report from last year, like neighbors were people that were aware of incidents going on, and friends and family, and parents of victims. So anyway, I'll turn it over to you, Keisha, and then I have a couple of questions to just get our conversation going.
Perfect. Like people said, my name is Keisha. I don't know, is it just us on the call or are there other people?
It's just
the 3 of us.
Okay, yeah.
And
so you pretty much just explain what I do. So I work for the Rose Andom Center, as you mentioned. So we are a family justice center model, and I will share my screen, and that will just explain it better. Okay, so I thought it would be easier to just kind of provide like an update on fatality review teams in Colorado. So like Amanda shared, so my role is really unique. So Colorado has a domestic violence fatality review board. This is something that was implemented following the passage of Senate Bill 2017-126. So essentially, this created a board to ensure stakeholder communication between stakeholders and policymakers. So basically, the statute allows for a city, county, or judicial district to establish their own fatality review teams. The board's role is more of like a liaison role. They kind of handle the policy procedures. What can a fatality review team do? Right now, across the state, there is a review team in Denver, Mesa County, and newly formed in El Paso County, which is really great for the state. So my role at the Rosanum Center is that Rosanum Center took on the work to continue the work of the Domestic Violence Coordinating Council. So it was a group of volunteers doing this work on their spare time, and they realized that this kind of work needs somebody full-time. So a position was created for somebody to do this work in a full-time capacity. So working with the Attorney General's office, I am in charge and tasked with collecting data on any incident of a domestic violence fatality across the state. And that's tied to the board. So I work with the board on collecting this data as they are required to create a report out of the scope of domestic violence fatalities in Colorado across the state. But then also I manage the Denver Metro Domestic Violence Fatality Review Team. So what that looks like is that I essentially am pulling together partners, folks that really kind of work with both victims and offenders. We have advocates, you have probation, pretrial, law enforcement, prosecutors, folks from DV organizations, really folks who kind of understand the cycle of violence from both sides. And really we take each case, we kind of expand the case at a larger level and understand how did we get here. The focus of these fatality review teams and the purpose of our group is really look at kind of where are the prevention and intervention points, where were those interventions missed, or where were those interventions, where were they utilized in those cases. So with
Keisha,
my,
can I ask a quick question just to make sure I understand? So
Yeah.
Is this only in the case of fatalities, or is this across all domestic violence?
So for my specific program, this is only for DV fatalities, but I would say at the agency that I work for, there is a collaborative domestic violence triage team where I sit on that as well, but we actually look at high risk cases that are going through the district attorney's office. And that is a lot of the kind of players that sit on my review team also sit on that as well. So cases are staffed from the DA's office that some of the concerning risk factors, so maybe access to firearm, threats to kill victim. There have been 4 more DV investigations within several months. So we look at those cases as a team, and then we coordinate between the individuals at the table who would be best to make that outreach to the victim, whether it's Project Safeguard, the Rosanum Center, Safe House Denver, and those are some of the key partners that are in our building.
I see, thank you.
Yeah, and so for under the statute, we're able to review cases from the 1st, 2nd, 17th, and 18th judicial districts. And the reason how that came about is what was realized way before my time is that after there is a DV fatality, it's learned that maybe the victim and the offender had there was different maybe intervention points that had occurred in different counties. So maybe the DV fatality occurred in Denver, but perhaps there was an open child welfare case in Douglas County, or maybe there was a violation protection order in Adams County, and none of that information came out until after. So it was really this identification of why aren't all of these judicial districts coming together and communicating until after the fact, and how can we kind of get everybody to come together before that. So some of the benefits of local teams, it's the awareness and dynamics of these communities, the opportunity to discuss challenges and barriers of victims, and opportunities to tailor interventions specific to the area. So like I said, we have a team in Denver, but then Mesa County has a team. Some of the crime and maybe some of the barriers that victims are facing in Mesa County can look a lot different to Denver County. And so with the establishment of new teams, a lot of that coordination comes back to my role. And I like to tell folks that what's working in Denver may not work for you in Mesa County. And again, for the new team being established in El Paso County, what's working for us may not work for you. So they don't have to feel like they need to model our fatality review process exactly similar. But I will say, where we've had success in our program is especially having that buy-in from law enforcement and prosecutors. So I actually invite the lead detective on the case and the prosecutor to present the case to our team, because we can't prevent what we don't know. And these are folks that kind of have the most knowledge on these on the cases because they work them firsthand. They've been able to talk to families and maybe witnesses. And so we're able to kind of expand our knowledge on that case more and be able to really talk about what could those intervention points have looked like. So a little bit about the data collection process. I was talking about this with Amanda. So we use, I say we, it's me collecting the data, but use a few different methods to collect data for the Attorney General's office. Unfortunately, there isn't a database where I can just like put in my credentials and I can generate all information on DV fatalities in the state. Through CBI, through NIBRS, the National Incident-Based Reporting System, law enforcement at certain periods of the year are supposed to report all of their violent crime to CBI, and CBI inputs that data, but sometimes there's a lag. But essentially, when I see like a news alert come or I'm told about a DV fatality, I begin to start tracking those cases. There's a spreadsheet that we use. There's about 800 variables that goes into this data manual that we use for each case. Basically that,
Keisha, I have a quick question. You have a data background? Are you like Amanda? Are you a statistician as well?
Thank you. I mean, I got my master's in criminology and criminal justice, so kind of, but if you would call it that. So maybe a little bit, but but I work closely actually with, there's a researcher that works with me. So I collect all the data and then she works with me and actually like I input some of it and then she helps actually like analyze everything and makes all the data look super pretty. So it's kind of, we work together, work in tandem. But
good team.
yeah, thank you. But basically, yeah. So before the data looks like what you have seen in the final report, it kind of starts like this in this code book. There's about 800 plus variables. So after each review that we do, this data gets input into SPSS. And then from there, Joanne, our researcher, then takes all of that data and is able to analyze it. But really all that information from the reviews, we really call it the deep dives, because that's where we can really dive into these cases, look at what's going on, look at these intervention points, look at where any interventions had occurred. If not, it's really from those cases that we can learn more. And it's really helpful for staff at the Rosanum Center to really kind of be able to talk through some of these things with their clients, because there's folks that kind of are then able to bring back not direct information because our meetings are closed, right? But able to, you know, things that they've heard in the reviews and then things to kind of be looking for when they're safety planning with their clients. So one thing that I will say is in this last year, and honestly my first year of doing this role, what we were seeing is that the fatality was the first incident of any violence for law enforcement, right? Which is striking for law enforcement. But Amanda, as you referenced, in that the data that had the information of who was more likely to know about the event, and that was like family, that was friends, those were folks close to the victim. And so as a community-based entity as the Rosanum Center, it's, you know, what more training opportunities can we provide for folks that are close to the victim or even the perpetrator about kind of recognizing some of these warning signs and escalating behaviors. So a big focus of our fatality review is looking at lethality factors. So this is the red flags checklist. So when we go through our review, we kind of go through this as a group based on the perpetrator at the time. So things that, and I think that a lot of times when we're talking about domestic violence, we talk a lot about, okay, well, did they have access to a gun, threats to kill victim? I think those are the common things, but I think right now, I would say in this role, things that are that concern me, if someone were to say to me that they're experiencing, are things that I would send some things in my head, especially the strangulation, the possessiveness, jealousy, where the perpetrator feels this abandonment or betrayal by the victim. Also, pending legal actions. We've had a number of cases where the fatalities have occurred right before a legal event, essentially where the defendant kind of recognizes, we call them hooks, that they realize that those hooks are off, right? Maybe it's a divorce hearing or child custody. They realize that, they're going to lose the victim, lose this control or power that they've had over this other person. And they're coming to terms with that fact. And we've had a number of cases where the fatality happens right before that event. And those are things that are concerning. But this red flag checklist is a really good guide for folks, I think, who maybe think of domestic violence and just like one lens, which is no fault to anybody. I think as a society, when we think of domestic violence, we think of just like the physical. And so folks that are experiencing that coercive control, that jealousy, if they don't see that or not, that's not talked about, it's hard to recognize themselves as being impacted by that or seeing themselves as a victim of that. And so last year, we had identified the highest number of fatalities since our board was developed. So in 2022, there were 94 DVFs, domestic violence fatalities, that had occurred in 62 cases. And total, so that is going to include perpetrator suicides, collateral deaths, primary victim deaths. So incidents where the perps were killed by law enforcement, that's law enforcement fatalities that are considered as collateral victims. And collateral victims, that's anybody outside of the primary relationship. So neighbors, friends, kids. And I wanted to put two charts on here that I thought were, I could have put a lot in here, but I just thought were relevant or could be helpful, but that just kind of showing over the last few years. We thought that so also I should clarify, the reports are coming out a year behind. So this 2024 report is going to be 2023 fatality data. The 2022 report was 2021. Yeah, I think I said that. Did I say that right? It's a year behind, essentially. But typically in our reports, we include statewide data and then cases that were reviewed. So this upcoming report that's going to be coming out next month, we're only doing statewide data, so that next year we're going to do a 20-year review of our reviewed cases. And from our reviewed cases last year, these were the most commonly known red flags off that checklist that I showed you. So firearm access, drug or alcohol abuse, the perpetrator felt betrayed, feelings of possessiveness of the victim, that loss of control, prior DV history, where we're seeing cases where the perpetrator is socially dependent on the victim, and then pending legal cases, the whirlwind courtship, financially dependent on the victim, and then also the perpetrator is dependent on the victim's caretaking abilities. And then kind of where I wanted to tie in with you, and I know, Amanda, you have questions, but kind of from the community engagement piece, from my end is information to victim-led supports accessible, and do people in the community know that there are victim services organizations available to them? and I feel like I'm like just yapping
Yeah.
and rambling, but I can
No,
like
that was
pause if you
perfect.
guys have any questions.
Yeah. So I don't know what the community knows about what services are available, but that's certainly a question we can we'll put up there. When you say is information to victim-led supports accessible, is that like, do people know how to contact the Rose Gandam Center for access to other, is that what would be the what would you want people to know how to access?
So, and I can segue into that, but that's something, you know, because especially with you reaching out, that was, I mean, that's a big question because I think when we're looking at in studies that show that, you know, how to prevent fatalities, you know, are folks connected to resources? Do they know about, you know, organizations or just, but even just like that access, like, has there been an opportunity for folks to know about supports, know about options for them? And I feel like a lot of times that's not the case. You know, we've reviewed cases where an individual was trying to leave right before the fatality, but they didn't know who to call, and that's so heartbreaking to hear, right? And especially as a employee of a victim services agency, it's like you hope that everyone knows who you are, but also the reality is like, you know, we can't expect everybody people to come to us, like we also have to go to people. So I'm so happy that you all reached out and like that this can hopefully start, you know, if there's events that you all do or ensuring that I can get our flyers and cards and things out to you all too. It's important. But I just really quickly too just wanted to like let you know about our services also, because I think that's important. And so as I mentioned, so this is what our building looks like. We are located really right by the courthouse, which is also really nice location, just kind of given the services that we provide. We're open Monday through Thursday, 9 to 5, and then Friday, 9 a.m. to 12. That's just for like Rose Andom Center staff. So there's other partners in our building that they have different times, but that's just for us. What's really unique about the Rose Andom Center is that we are a family justice center. So that means that we are basically a one-stop shop for a survivor who is experiencing domestic violence. So really anything that they may need for what they are experiencing is in the building. So Rose Andom Center is the main DV organization, and then they can decide if they would like to access systems-based entities or community-based entities. The Rose Andom Center is a confidential-based advocacy center, so you know we do not share any information with anybody. If we are to share information, that is with our client's permission, and there needs to be an ROI. But also Rose Andom Center staff are mandated reporters. So if somebody is sharing something that is a harm to themselves or others, they would need to make a report. But what is really great about that is that victims don't, if they're not ready to maybe make a report with law enforcement, that doesn't negate them from accessing services. So in terms of kind of confidential based advocacy staff, you have Rose Andom Center. I'll jump quickly here, but you have Rose Andom Center, you have Project Safeguard, who is the legal advocacy agency. So they help with protection orders, divorce, custody. That's who we rely on for all legal matters, which is a huge need, especially in Denver. I would say for folks that come into the building, that is a big resource that people are looking for assistance with protection orders. But Project Safeguard, they also have advocates who work out of the courthouse. So that also is helpful, especially if people are, you know, need help with paperwork. There's staff who are there. They also have clinics that they host, but they're a really great organization. We have Safe House Denver. So that is the like shelter organization. And so what's nice is that at the Rose Andom Center, being that everyone's under one roof with staff with basically their satellite offices, it's, you know, they're able to let us know, you know, how many beds they have at shelter, which is great when advocates are working with victims. And that is something that a victim is needing. There's that direct communication. And really, I think the importance of that family justice model is that that's like that direct handoff, warm handoff, instead of like, okay, well, you came here for this and now you need to go downtown for this, but call this number, and that not really ensuring that that contact is made before you send someone out the door. But here, you know, that like you literally can walk someone down the hall to who they're going to meet, and they get to watch that warm handoff as they walk into the room that you were just in with them. Servicios de la Raza is one of our kind of, I would say, one of our cultural based agencies. But they don't say that essentially, while they focus on serving the Latino population, that's not only who they serve, and they welcome anybody, but they offer a wide range of services. We have the Cultural Development Wellness Center that was formerly known as the Asian Pacific Development Center, if any of you were familiar with that. Maria Dross for counseling. Motherwise, they've been a great partner in our building. They offer parenting classes. We have a child care room, which is a huge barrier, right? To even start to access services, because what about childcare? Who's going to watch my kids? So they have a child care center. We have a room where parents, can watch their kids through the child care room while they're being with their advocate or whoever, and it's really helpful. Healing from the Heart, the Blue Bench, they provide sexual assault services. The Denver Children's Advocacy Center, Latina Safe House, and Undestructible. In terms of our government agencies, we have Crime Victims Compensation, the Denver DA's office, the City Attorney's office, the DV unit of the Denver Police Department is housed in our building, which is also great. So if there's folks that do come in and are like, I'm ready to make a report, staff can connect them to the Victims Assistance Unit to help facilitate that. And then we have Denver County Court Probation, and then Denver County Pretrial Services. Also, it's helpful if somebody has like a current case, or maybe their offender is on probation and they have questions. There are staff who are victim advocates for probation, who their role is working with victims, so they can help provide victims just notifications about kind of what's going on, things that they need to be updated on. So it just really comforting to work at a place where knowing that all of this is happening, and it just where the partnerships are occurring every day. Something that's also really unique about us is that we have a medical center that's set up through Denver Health. So they can do primary care, emergency room follow-ups. They don't do sexual assault kits. That's something that they'll refer to their main facilities, but they can do birth control, STI screenings. But I would say, especially if there's someone who's nervous or hesitant about receiving services, it's been nice having the medical clinic there. And also the medical clinic has been a really safe way for victims who have perpetrators who are very controlling. And we've been able to basically disguise that they've been coming for, advocacy services and other things, as just that they're coming for like a medical visit. And then while they're there, they've been able to receive other services. So it's just, a good way for folks to be able to round out everything that they may need in a safe way.
So Keisha, I have a question.
Yeah.
I don't know if this is now a good time where you wanted to finish.
No, this is good. I feel like that was kind of just like a quick kind of summary of the Roseanne M Center and like our services, what services we provide.
First of all, I just want to thank you for meeting with us. This is it's kind of overwhelming to hear all this, to be quite honest. There's so much going on in a really important area that I just don't think people realize these services exist. So much, at least I didn't know, and that doesn't mean that obviously lots of others may, but so I have a lot of thoughts going through my head about what we need to do in our community to promote this. But one question I have is, how do people typically find you?
So a few different ways. So people can find us through referrals, through our like referrals through partners. People can walk into our building. They can email. They can call.
But do you market anyway? Do you, other than these kinds of?
Oh, yes, sorry. My computer is gonna die, so I'm gonna jump on my
Oh,
cell phone now.
yeah, sure, sure.
Okay.
Sure. Yeah.
Let me. Okay, can you all hear me?
We can.
Okay.
Yep.
Okay.
And we can see you too.
Okay, perfect. I was telling Amanda I'm at a coffee shop, but I think they're closing, so I'm just gonna step out. But we have a development team, but I also think that that's something that I, as being in my role, have kind of said, thank you, sorry, you too. I've kind of talked about in the sense of like,
Ooh. We may have lost
expect
Keisha.
that people.
Oh, you're back. Keisha, we lost you for a second.
It was a glitch coming off the Wi-Fi, I think.
Yeah, exactly.
Oh, can you hear me?
Yep.
We can hear you just fine now, yeah.
Okay. I think that, sometimes we expect that people will come to us, but that we also need to go to where people are at. And so I mean I would love to also, I think after this, like if it's also connecting you all with our like development team and what that looks like. I know that we we do like tabling events, and we do we're at Pride and we're at other events, but I don't know where. I think it's just where other folks in the community are, and if they're accessing the event. I mean, I also am like a data person, and I like, have like pinged out the different addresses where these DV fatalities have occurred, and so I'm like looking at where our building is located, like right in the heart of downtown, and then like say like the ones that have occurred in Central Park. I'm like, I mean, if people don't have transportation, and also I should add, we do provide lifts for folks to come down to the building. So I mean, that's one way, right, of getting folks to the building. But the other issue though, I think, is how do folks know that we exist, right?
Exactly. Yeah.
And if there's language barriers, so how can we make sure we're marketing ourselves better? And I think from our conversation today, I think what I'm hearing is the next steps of for sure making sure that we get you all our materials, our flyers, our cards, our business cards, our things that can be passed out, our handouts. I think that's like a first step. But
yeah, I mean, I think we should talk also after this, just what we think is the best, most efficient way to get the message out about you. We have a few different avenues for communicating with the community, because that's really what we are. We really are. I mean, we advocate for our community, but we also we're primarily outreach to our community. But we're a big community now. That's the other thing. It's complicated. You could come talk at our board meeting, but you may get 20 people instead of us. It would be better if we could get somehow get you in front of a few thousand people somehow. I mean, we do have email updates. We also put on events sometimes. But we need to think about what's the best, most effective way for us to get, because I just don't think people realize your service, and obviously it's important. So Amanda, I think you might have a question. Am I right?
I do have a couple of questions. I also have ideas of just like good connections. I mean, I don't have, do you guys ever just participate in like the Denver Public Schools email blasts that go out to all families, or like even from schools, just to put like information, and not just, well, and this comes
that
back
I don't, sorry, that I don't think so, but honestly, that would be great, because we've had some cases that have involved younger folks, and I think the discussions in the group have always been like, how can we get into the schools, or what conversations do we need to be having with, especially with teen dating violence and the language and things that are coming around. But I mean, but even if the schools just like know that we're available, because some of the different organizations just have different policies about serving minors. But
Well, it would be like emails directed to parents,
oh
typically
yeah.
more. I mean, I'm sure that this is, every student has an email address, but I was thinking about the messages that I receive from the district.
Oh yeah.
And so
Yeah.
you could target parents that way.
Mhm.
And I mean, I'm just like, my mind just goes straight to like women and like women with children and how to contact that. But I did see
Yeah.
that the range of ages is much wider than just that. And there are men that were victims as well, but that would at least get like people who are in that parent cohort in like
Mhm.
one school system. But that would be a way, just school systems in general,
Yeah.
contact people. But then so one of the questions that I sort of came at this with initially was, what's the best language for talking about this? Like, is there any language that if you put it out into the community might escalate a situation? Like, do you just say like, here's a hotline for people who are victims of domestic violence? Or do you say like, a lot of people don't realize that controlling behavior and jealousy are part of the constellation of domestic violence that can then escalate and result in horrible things? Like, do you say that or do you not? I mean, because I feel like that's where people are like, oh no, I'm fine. And then it's like, well, but then they're not. How do you help people realize that they're part of something for which you offer services, as opposed
Mhm.
to just saying like getting people to identify as like someone who might need the services?
Yeah. I think it could be done in a few different ways. I think trainings. I think, but also I think the candid conversations, because I think currently sometimes some of the messaging, I think people with some of the messaging, people don't see themselves or aren't able to identify themselves as being a victim or survivor, because it's not resonating with them, it's not sticking with them because they don't see themselves in it. I think in the cases that we're seeing where there's a lot of jealousy, there's a lot of control, possession, I think even cases where there's a lot of stalking that kind of ties back into that jealousy, possessiveness, I think that gets secondary, I think, to some of the more glaring like physical violence. But because I don't think there's that realization, and I honestly don't think until like now it's like, whoa, like these cases can still result in a fatality. You may not have had any physical events
Right.
before, but this like escalation of things have now led up to this point, and it's resulted in a fatality. Like, so this behavior is still concerning, and I'm concerned for you. I think if I was talking to a friend, like, these things that you're telling me are concerning to me because of this. This person is not letting you talk to other people. They're making you stay on the phone while you go into work. You have to talk to them when you get into work, and you have to FaceTime them while you're at lunch, and just kind of that complete isolation from anybody that would be people that could support them, later on, and just kind of how that gets weaponized. There's a power and control wheel that often is used in these spaces. I can tomorrow I can kind of pull up and dig up some stuff and send it, but there's a power control wheel that is used, and when we're doing trainings and stuff, we use it. It's based off of the Duluth model in Minnesota, but basically it kind of breaks out power and control dynamics and how it's kind of like manifest, and that I think is a good tool. But that is one where it doesn't really, if you're not experiencing, I think, any like physical, sexual, emotional, or financial abuse, you may see yourself missing. And so that's one where, like, for folks who are experiencing that, it's a good way to be like, okay, I see myself in this. But also the danger assessment, if you've heard of that. So that's a tool that folks in this space, like advocates, will do with their clients. And the danger assessment, I think, also is a really good tool that gauges the threat of perceived threat of danger for clients. And the questions in there, I think when I was an advocate, I think asking someone those questions, I think you see the wheels turning in someone's brain of like, you know, kind of thinking about I'm not thinking of like, there's certain people in my life that would never like, I mean, there's a question that asks, do you think this person could kill you? And, you know, I've had clients that are like, I don't know, you know, and I, you know, to kind of talk to them, I'm like, you know, are there people in your life that you can say with certainty that would never kill you? You know, I mean, it's a hard question. Like somebody walking on the street could randomly decide to kill me, but when you're talking the context of intimate partner violence, and this person has been causing you harm, and compared to other people in your life that want well for you and all this stuff, like there's people with certainty that you're like, you know, that they wouldn't cause me harm, you know, is that person one of them? And with certainty and quick, you know, they're like, no. And I think that's really shocking for somebody to have that come out of their mouth. But tools like that, the danger assessment, and there's a series of questions that we ask. And I think even that is kind of like that someone is able to kind of start to process some of these things that they've experienced, you know, like I think it's, have you been strangled? And but yeah, I think, and so to answer, I think a few different ways. I think trainings are always really helpful. I think of just because it's hard. I think it's for us also, I would say, in the place of an advocate or whoever, you know, I see our job as being able to let someone know that there are resources and being able to point them to resources, but not to say that this is what you need to do, because they are the driver. And you know, when I meet people and they come through our doors, and when I was an advocate before, I'm like, you know, you have kept yourself safe to the point where you feel comfortable to come into these doors and to ask somebody for help, you know, to open up to somebody else and say, you know, I'm here because I need help, you know. And that survivors and victims are every day kind of mitigating the risks any way that they can possible to make it to the next day. And I think that anybody that is working with the victim and providing resources, and it kind of understands that as like, it's not for us to be like, this is what you need to do, because they know this person better than any of us. So
David, any questions from you?
I'm just kind of taking it all in, honestly. I was like, I just can't, I can't even imagine like that people live like this, or live in these situations. Like how horrible. And like, yeah, I was like, you all, like the work that you all are doing is so important. And I was like, it's heavy. And I was like, I also wonder, I'm like, how do you, like, when you're supporting someone who's in this environment that's really, really hard, like how do you kind of like balance like caring for yourself and caring for the person? Like, I don't know, does that make sense?
yeah, it's just kind of like that, like self-care for you, but then also like knowing that you're taking on, like, you know, like listening to the, like, essentially like the worst part of someone's day. I mean, it's definitely, it's hard. It's hard. And I think but also like fundamentally, I'm like, no one should live like this. Like you know, and I think it's a balance. I think for me, because I've been on the victim services side now, I think for me, I was like, I've done the victim services. I like research. And so I was like, I think for me, I need to do research because I need a little break, and knowing that I'm doing research and it's still impactful and getting to see the numbers put into action. But I mean, I know it takes a toll on my coworkers, people that I work with. And I think, yeah, I think everybody has their kind of things. I mean, it's silly, but for me, when I get into my car, I take off my badge and I'm like, I put it in my glove compartment in like the closing it is like my, like, I'm leaving that in there and that is staying in there and I need to like turn off for the day. But I also think you just have this investment for the people that you're working with and care for. And my role is a bit hard because it's not direct service. And, you know, the people that I consider that I'm working with, you know, have passed, but I care deeply about them. And when I'm reviewing these cases and, you know, so when I see some that there's been, you know, a homicide or something, I mean, I hate that my first thought is, you know, is it DV related? And there's different cues and things I see in the media that would make me suspect that it would be, you know, and that stinks, right? Like I'm like, I shouldn't have like be immediately thinking about this, but it's like when I see that there's a murder suicide, I mean, immediately that's my first inclination, especially if it's, you know, reported that the people were known to each other and they were in the same home. It's, you know, so I mean, it's hard, it's not easy, but it's a process.
But it's so important for someone. I mean, this is such a great example of where research is so key because you're identifying these red flags, so to speak, these behaviors that I don't think most people understand. I think like when we ask, you know, when Amanda said she asked the police, like, well, what can we do? And they said, well, you know, you need to report if you hear things and like that. It's like we're all conditioned by media and television and movies that like in that there's going to be there are going to be repeated violent outbreaks
Mm-hmm.
lead to this. And what you've one of my big takeaways from this conversation is that it could be very specific behavior that could then lead to a tragedy without
Mm-hmm.
all this stuff that kind of Hollywood is telling us is going to happen before we get to, you know, the point where you can't stop it.
Yeah, because I mean, I think, yeah, that we're all have been like conditioned to think that like the cases that I review, you know, are going to be ones that there's been a long history of DV, the police have been called, there's been all this stuff. And I feel like, and when I'm selecting cases for review, I feel like very few have had that. And I don't choose cases like that if there's any inkling like that, because I'm like, I want to be realistic about what the folks in the room and the clients that they're serving of like what it is actually looking like, you know, there may not have been prior incidents because the victim maybe didn't feel comfortable reporting, you know,
Yeah.
maybe because, and some of the barriers that I know have occurred or things that I've heard from talking with, you know, my coworkers, right? You know, there's folks who have had bad experiences with law enforcement. There's folks who have been system impacted and have like a criminal record. So they don't feel safe making a report. So all these barriers. And then when you're thinking about kind of like the larger context of the power and control, you have perpetrators who know that, and have used that against their victim. And so the victim is like trapped. And it's like just how this cycle is able to fester. And then, I mean, and then that's just like one thing. And then, you know, if you have individuals who are experiencing substance abuse and misuse, whether it's the victim or the perpetrator, and they're both, you know, kind of struggling with that, how that also on top of then being a survivor of domestic violence and, you know, just isolated from everybody else, they only have each other, no support from family, how just things can intensify in that situation, you know, and what does support look like, or what would access to services look like in those situations, right? Especially with someone with a criminal history. And unfortunately, you know, if somebody if law enforcement knows that you have like a warrant out, they have to make an arrest, right? And so when that happens, even though it's not like they want to do that, especially if you're someone that's coming to seek services, right? But what does that look like? And then and just kind of negate for other things. And yeah, so I think there's a lot of like nuanced situations and it's tricky, but it also like is really important to look at, because I'm like, while no situation is like exactly the same, I think there's a lot of some similarities in different things, whether it's, you know, folks who've been system impacted, they're experiencing substance misuse, where there's children involved, that we can learn from those cases. And also I think with like bonds and other things, right, on how that's impacted some of the cases that we reviewed too. And so
Yeah, and so we're coming up on the hour, so I want to be respectful of everyone's time for sure. But Amanda, I know you may have come with some questions that you haven't had a chance to ask. I want to pass it
Yeah,
to you.
I have a couple of things. Maybe I'll wait until we're sort of back offline again, and then and I'll
Okay.
just say a few more sort of more. Yeah, I have a bit more, but I don't think it's.
Okay. Okay. I mean, I think, I always like to sort of wrap up with kind of next steps if we can. And I think sort of from the CPUN perspective, I think we need to think about how best to educate our community about the services that are offered in domestic violence, around domestic violence, which is more than obviously the research you do, but you're our person to kind of continue to communicate with. So maybe next steps are, the three of us, maybe it's a board discussion to kind of talk about, we can collaborate maybe with we have a communications committee, we have an education committee. These might be areas where we might be able to collaborate and come back to you with ideas on how to effectively educate our community about it. I love the idea of a training personally.
yeah.
I think that would be something, but I would want to make sure if we're going to do it, that we could get enough people aware of it to where it would be, worth your time. And also
Yeah.
get a lot of people there. That would be our goal.
What's the size that you would hope for in a training?
Me or
Yeah, how
The
many
people who
people
do the
would
training.
you?
Yeah. Like
Yeah.
oh
if we were to do a
I
community
mean
level training.
I don't have a specific number. Sorry, something like flew into my eye. I mean, honestly, I feel like even if there was like 15 people, it's 15
Okay.
people now are aware of domestic violence, and
Yeah.
haven't, and now got this information. So I am like,
And we
I
have a
really,
space to do these things because I assume we could use the MCA cube to do
We
this.
have a couple of different spaces. There's the community room, the library, the rec center, multipurpose room, the cube, like maybe any of the schools would let us use their libraries after hours. I think there are a number of different options.
Okay. Okay. And it seems like I thought your idea, Amanda, about communicating to parents through the school was a really good one. I don't know if that is something where it's just through DPS or it's something we could maybe facilitate here. I don't know.
I think we could facilitate with the individual schools, but then the district also sends just emails to every single person who's participated in the school choice, which is everybody who's in the system. And so that would be a way to hit every adult who's associated with a child who's in the system.
Yeah. Yeah. And okay. And Keisha, anything's come to mind that you would want us to do as sort of next steps? I mean, other than we want to continue to communicate with you, and I think we do that through Amanda. I think that'd be the easiest, if that's okay with you, Amanda.
yeah. Oh, yeah. I think I can think about it some more, but I do think a training would be a good idea. And I also could chat with some of the folks that I work with too. Like, well, one obviously like I think if we are talking about like communication stuff, the development team, but there's folks that like I work with, and I mean I know the person I'm thinking about, she goes and talks to different like police districts and stuff, and some of like we do presentations together, we do trainings for the police academy, so I know that she would like love to do that, so it's something that we do together. I kind of forgot about that, but yeah, we do training for the police academy for their basic recruits like quarterly, so kind of basically about these things, like things to be looking for, which is really great, especially for like new officers, and I think that's like the value of having the DV unit in our building, because I don't know, not saying that maybe that wouldn't be like a thing that would come of it, but I think it just kind of speaks to the relationship that we have with the DV unit of the Denver Police Department that's housed in our building.
Yeah.
Forever ago, Detective, oh gosh, I don't know if I can remember her last name. Her first name is Marika. Oh, here it is. He was our,
Just the community
Lawrenson, Marika
liaison?
Lawrenson used to be our community resource officer forever and ever ago, and she's she's part of the support team for
Oh,
domestic violence now. I don't know if you've worked.
no.
Yeah, I mean, there are, like I said, we also have this email that we send out to the community that is a way for us to communicate. It does get fairly good penetration into people's emails, but people get a lot of emails, obviously. But that's something that we could consider as well. So maybe as our takeaway is the three of us will continue to talk about how best to take next steps to educate the community about the issue of domestic violence in your organization. And if you would be willing to speak to your your communications department or your outreach department, if they would be willing to speak with us, we would like to have that conversation at some
Yeah,
point. Okay.
I can totally do that.
Okay.
And then also this video will be posted on our website and we
And
can
this
refer
video
people
go
to
up
it
on the
and
website
that's
as well.
education in itself because you're very thorough. Thank you.
Yeah.
All
Okay.
right, I'm going to stop
Hopefully
recording now.
hopefully it was helpful.
Incredibly, yeah. No, it
Okay.
was eye-opening. Thank you.
Am
Yeah.
I okay to stop recording?
Yeah, we can stop.
Okay.